Nagaland State AIDS Control Society ra aji August 19 NSACS Conference Hall Kohima ni launching of Intensified IEC campaign 2024 upper press conference lishe. Campaign launch krado HIV aro sexually transmitted infections upper jankari dibole karne ase. Campaign laga maksad do general population majodi HIV aro STIs laga accurate jankari dibole ase. Idui na hoigna safe practices promote kuribole aro stigma komti kuribole karne ase. Intensified IEC campaign do August 12, 2024 di launch kuribo.
I would like to begin by giving you a brief background on the reason why we kind of organized this press briefing today. And yes, so this relates and this basically is to do with our proposed planned intensified IEC campaign fixed for the 12th of this month, where our Honorable Chief Minister will do the honors by way of being the special guest at the launching function on Monday. That is. So here, this is going to be a pan-India event, and India has a very high number of people living with HIV, and even though the national HIV PR, the prevalence rate, is low, there are approximately 25.44 lakh people living with HIV/AIDS in India. And just last, as per the official count of 2023, we have 68,450 new cases. So, yes, and there are certain states that have shown a rising trend, including some of the states here in our northeast India, such as Arunachal Pradesh, Meghalaya. Fortunately for our state, we have been to some extent able to stabilize the epidemic, and as such, for the last 4 or 5 years, there have been no increasing spike in the graph. And presently, however, we still stand at as per our prevalence rate, we still stand at number 2, only next to Mizoram. And presently, we have a prevalence rate of 1.34. So, in order to enhance the knowledge levels of awareness to our general public, this intensified campaign is going to be held, and this is going to be following the launching program. This is going to be a 2-month exercise. So this is intended to reach all nooks and corners of our state. And the key objective of this entire 60 days program is to, and as I said, is to enhance the knowledge and understanding for the general public. Number 2 is to promote safe practices and reduce stigma. So, as you are aware, the major step that we can take towards creating awareness to our public is through this kind of awareness activities, and as is obvious, this can be achieved mainly through our media. So under IEC, a lot of activities have been planned, and in detail, our concerned program officers will dwell upon the details, the activities. However, there will be broad-based two types of category based on which all these activities to be carried out. One will be rural activities and one will be urban activities. Under the rural level, we will have village level meetings and HIV awareness. Then we shall be having school outreach programs in all villages as in we have shortlisted 780 villages. Then we will be disseminating information on HIV, STI through our IEC materials. We shall be having interpersonal communication sessions with village health, sanitation, nutrition days. In the category of the urban level activities, we shall be having, it shall be launched through a rally. Then we will be having flash mobs and awareness sessions in all colleges, especially through our RRC, the Red Ribbon Club agencies. We shall also be having special camps at government hospitals and also sensitization programs for our ombudsman and complaints officers. So, as I said, to go into the details, further details of this, I will now give the time to our Deputy Director, IEC Division.
Yeah, as mentioned by our Project Director, we will be having campaign activities at the rural as well as at the urban levels. And this rural levels is planned at 780 villages in Nagaland. And this will be conducted by our field functionaries at the district, and this will be done in coordination with the district administration and village council. So, because for this campaign, we will require and we really need the support of our district administration, including the village council, because we are going to have village level meeting on HIV and AIDS. So, because 780 is a huge number to be covered under the 2 months period within the 2 months period, but we are hopeful that our dedicated staff field functionaries at the district can do it. And this is we have selected 780 villages accordingly because we wanted to have maximum reach, and in Nagaland we have total villages of 1,280 as per the census. So we are taking 60% of the entire village. So we want to cover almost all the villages, but within 2 months, it's impossible also to cover all the districts. But we are taking maximum reach, at least 60% we want to reach out, and those villages are the villages where they have less access services to HIV facilities, facilities at the district. So we are selecting those villages on need based, and this is being done. The micro planning is being done by our Disha team at the district. So they are selecting the villages according to the need and prevalence of HIV.
So the 780 plus villages will be covering all the districts?
Yes.
So when we see zone-wise,
yes,
that is covering the urban or Kohima and
the zone-wise is for the youth convention.
Oh, okay.
Yeah, it's different. The zonal is for the youth convention, but the villages is district-wise. Yeah. So 780 villages. We have the breakup here. If you want to know, Dimapur. So Dimapur covering Newland and Chumukadima. We have 129 villages to be covered. Kifri, we have 63 villages to be covered. Kohima, including Sininu, we have 68 villages. Longlang, 28 villages. Mokchung, 52. Mon, 73. Peren is 52. Hek is 59. Tunsang, including Shamator, is 46. Wokha is 80. Zunheruto is 102. Noklak is 28. So total is coming to 780 villages. So this is the challenge that we have taken, and I hope and we are we are sure that our field staff, our field functionary will do well and reach out to and try to cover all the target that we have set. But under this campaign, we are taking this challenge and we are ambitious and we are very enthusiastic that it will be done. We will be able to reach out to these people, to these villages.
Yeah. I also wanted to know Dr. Ahmed's please mentioned that monthly prevalence rate HIV is still, it has not gone up or at immediately that level. Reason of that? Is it the maximum tests are not done, or is it because people are not coming forward?
No, I would say I would look at it another way, in a sense, see, this is based on the prevalence rate, not the absolute number. If we consider the absolute number, like for example, say a state like Maharashtra, it has more than 3 lakh people living with HIV/AIDS. Whereas in Nagaland, we have precisely 14,130 as the latest study. People living with HIV/AIDS, in a sense, people who are also under medication. So, the reason we have been able to a large extent, stabilize this epidemic is because of the consistent efforts of our state machinery, specifically under the organization of. In that context, at the beginning, I was just enlightening you, in a sense, sharing with you regarding the increasing trend of some states in the mainland also and in the northeast also. Fortunately, our state has been able to keep it at a stabilized status.
Little highlight of the program that will be associated with the launching of Intensified IC campaign on the 12th at NBC Convention Hall. So on the day, we are expecting around 2,500 students and delegates. So this, we are going to have different kind of activities on the day, like exhibition stalls and photo booth, selfie point, HIV and syphilis counseling and testing, interaction with HIV drug users community, autograph signing and selfie with the Red Warriors, our influencers. And we also have games and competitions which will be done through the SDG and the Birds and the Bees talk. And we also have social media kiosks, pledge signing, and we have exciting gifts for the students who will come and people who are following our social media pages and social media platforms. They will be awarded. They will be rewarded with gift hampers, and we also have face painting. So all these activities will be done on the day, on the 12th of August. So we want to encourage the students to come prepared and be excited for that day. So these are some of the highlights that we also want to share.
For your information, our usual normal activities under the program will go on as usual in these 60 days. But as the name implies, this is going to be a period of intensified IC campaign mode. So all these activities will be under that theme. And once again, to remind, request, and also to take this opportunity to acknowledge the partnership and the contribution received from your fraternity down the so many years. We take this privilege to thank you, and knowing that the most effective way to carry out this awareness, and as we all know, there are so many activities, ongoing activities, especially to do with awareness. And the key to creating stabilized HIV status in our state is only through awareness of the general public. And this can be effectively done, especially through your fraternity. Therefore, I solicit and request your full cooperation in the days to come also. Thank you very much.
Emporium Nagaland is India's premier aviation, hospitality and cruise line training and international job placement consultancy. Trained and blessed over 20,000 youths from Nagaland in prestigious international brands. The only institute in Nagaland that hosts top airlines, cruise and 5-star hotel campus interviews. The first institute to conduct international cruise campus interview in Northeast. We are open to students of class 10 and above. Emporium provides 100% placement assistance, empowering educated unemployed youths with global opportunities.